Our flagship program, our Master of Health Administration program, was started in 1949, and the first graduate degrees were awarded in 1952. And fully accredited by the Commission on Accreditation of Health Management Education since as early as they were formed. It was the Accrediting Commission on Health Management Education before, but we've been continually accredited. We have that is our flagship program. We have another master's, a Master of Science in Health Administration degree that we started in 1988. Just a little bit of difference between the degrees. The MHA degree, our traditional one that I started talking about, is a 3-year degree, 2 years didactic learning in the classroom, and a 3rd year in an administrative residency, and you graduate at the end of 3 years. The MSHA program was designed for working professionals who have a minimum of 5 years of progressively responsible supervisory or management experience, and they are employed in healthcare. They come in, they begin and end every semester on campus, and the rest is online. So it's a blended or hybrid program. That is for working professionals. It's 2 years of didactic and practical work while they're in the program, and they graduate at the end of 2 years. The shell that we use for our courses is Blackboard. So many people are familiar with that administrative learning system. When they're on campus, they begin the course by getting the overview, the syllabi, and all, and the initial lectures. Sometimes the on-campus is longer, especially for a quantitative course, as opposed to one that's more reading-based, so that a lot of the methods are covered on campus. Then when they're back online, they would review what they did on campus, but then start discussions online. Quantitative courses have problem sets and all that are posted. Some use streaming audio that can be connected, again, through the Blackboard system. We have our own calendar for the blended program, where they're usually on a course for 2 weeks, then off and on and off. So if you're taking 4 courses, you'd only be online with 2 at any given point in time. In some semesters, there's only 3 courses, and we have the quantitative one when the qualitative ones aren't being offered, so that they have more time to work on problem sets and all. They're just completing their baccalaureate degree and coming to graduate school. Hopefully they've done some internships or exposure and can speak to that in their personal statement when they apply. When we interview, we're looking for a knowledge of the field so that they're not just entering because they're continuing school, per se. They have to know what it is they're entering when they come into the master's program. For the online program, these are the practicing professionals. And what they are already employed in healthcare. They may be physicians, nurses, physical therapists, dentists. We get from every field. What they're looking for is the management background to be able to take on additional responsibility in a healthcare organization. All of the requirements are really clearly laid out on our website, but for both programs, the MHA and the MSHA, but there's a basic minimal GPA. We do require standardized tests, GRE or GMAT, with scores greater than the 50th percentile in both quantitative and verbal in those both areas. We're looking for 3 recommendations for both programs, and then a personal statement of why it is that you want to do health administration, and we're looking for what interests they have in this field and what ties them to it. What is their passion and why it is that they really want to pursue this graduate degree. And then we ask for a resume so that we can see what they've done. We're also looking for their involvement in their communities and what service they've provided. So we're looking for a really well-rounded individual. It doesn't matter to us what their baccalaureate degree was in necessarily, but the knowledge of the field, the interest, and commitment to service, because we see that as a real role of any executive in healthcare. Our programs are ranked fifth in the country by U.S. News and World Report, and we feel that that's wonderful on our programs because although we've been in existence for a very long time, we're a smaller program. We're not in a large school of public health. We're in a school of allied health professions, yet we're a well-established program, having been in existence since 1949, and that gives a lot of ties to our alumni. We've got a large alumni base out there and a network to be able to place people in their third year administrative residencies because many of our preceptors were people who went through the program and are now higher level executives. So we've got a good exposure in that respect. Our program is on the Medical College of Virginia campus. And prior to the formation of Virginia Commonwealth University that happened in 1968, we were the Medical College of Virginia program. So many of our alumni still identify with that, but our campus name is still the Medical College of Virginia. So that branding is out there and known. So we're tied uniquely to a medical center, the only full service medical center here in the Commonwealth of Virginia. 2 weeks ago at the American College of Health Executives, we received a Higher Education Network Award. We've received this multiple years in the past. We have this whole wall of these plaques where we're recognized as one of the leaders in people continuing on and continuing up the ladder to become fellows in health care administration and board certified in our field.